I'm going to gather my supplies. I have my warm water in my basin. I have my washcloths and my Foley tray, and make sure there's good lighting. I will do hand hygiene. I will go and introduce myself. Hi Annie, my name is Diana. I'm your nurse here this morning. I'm going to be inserting a Foley catheter inside of you, but first, can I get your name and date of birth? Okay, I'm just going to check your allergy band. Do you have any allergies to anything, Annie? Amoxicillin? Okay. Do you have any allergies specifically relating to iodine or latex? No? Okay, good. So I'm going to provide privacy. Raise the bed up to working level height. Before I explain the procedure, I'm going to verify the order. 16 French Foley catheter. Okay. Annie, I'm going to be inserting a Foley catheter inside of you. It goes into your urethra and into your bladder, and it helps relieve all that pressure in there from all the urine. Do you have any questions before I begin? No, it is not painful. It'll be a little slightly uncomfortable, but it'll go away. Okay. And first we got to clean your peri area. Would you like me to do it or would you like to do it? Okay, I can do that. I'll cover my patient. Make sure the patient is laying in supine position with legs abducted and the genitalia exposed. Okay. I'm going to apply clean gloves. First, start on the outer labia away from me with one swipe down. Then the outer labia closest to me, one swipe down. Inner labia away from me, one swipe down. Inner labia closest to me, one swipe down. And then right down the middle. Okay, I'm going to drop that into my laundry bag. Okay, I'm going to first pat dry, outer labia away from me, pat dry down. Outer labia closest to me, pat dry down. Inner labia away from me, one pat dry down. Inner labia closest to me, pat dry down. And then pat dry down, right down the middle. Okay, I'm going to drop that. Take off my gloves. I'm going to move my basin off to the side. I'm going to perform hand hygiene. Okay, I'm going to take my catheter out of the tray using a sterile technique. Okay, drop that. Okay, I'm going to keep this for documentation later on. Okay, I'm going to open it containing sterile technique. I'm going to first drop this in front of my patient, remembering that I have to stay within the 2 inches. I'm just going to drop that down. Okay, I can fix that later on. I'm going to apply sterile gloves using sterile technique. Okay, make sure I stay within the 2 inches. I'm going to first grab on the outside of the cuff, insert my hand in without touching this sterile glove. I can fix the cuff with one of the other gloves on. I'm going to go inside of the cuff here, insert that. Making sure not to touch, and then I'm going to fix this. There you go. I'm going to drop that. Since we are putting a catheter in a female, we do not need this. I can drop that. I'm going to now squirt my iodine in there. Drop that. Then I'm going to insert the syringe of water into the port and lubricate my catheter. going to take my catheter out, making sure I'm going to lubricate the catheter without touching the tip of it. I'm going to leave that in my tray. I'm going to insert the water into the port. Okay. I'm now going to put everything, the catheter itself and the syringe, into the tray in here. Since it is sterile, it is okay. Then I'm going to now move my tray between my patient. Okay. Move this off to the side a little bit. Okay. I'm going to now use the cotton balls with the iodine and now clean the patient, the outside labia, one straight down, drop. Closest labia to me, outside labia, drop. Then I'm going to use this and spread and do the inside labia away from me, drop. Inside labia away from me, drop. And then one swipe right down the middle and drop that. Okay, I'm now going to keep my hand here. I'm going to insert my catheter, making sure it's already lubricated. I'm going to insert that into my patient without touching to maintain sterile. I will go until I see urine. When I see urine, I will go another ½ an inch in. Okay, I will now inflate my balloon. Maybe not. I'm gonna go this a little further in. And then inflate my balloon. 10 cc's, just like the order had asked for. I'm gonna keep holding that and just use one hand to take it off. Drop. Okay, and we can now make sure it's in place by tugging on it and making sure it doesn't come out. I'm gonna put it back in so it doesn't rest on the urethra. Okay, and then I'm gonna let go. I'm gonna take off my gloves. Perform hand hygiene. And then apply nude gloves. I'm going to now take the Foley catheter and put it on the bed frame, making sure there's no dependent loops. Maybe. Making sure there's no dependent loops, and onto the bed frame. Okay, now I'm going to attach the leg strap. This is to secure it and make sure the Foley doesn't get ripped off, because that would be very painful. I will now clean up my supplies and dispose of it. And then now I'm going to clean the patient off the iodine so it doesn't stain her. I'm going to take off my gloves. Gather my supplies. I have my basin and my washcloths. I'm going to perform hand hygiene again. And I'm going to apply new gloves. And this time, since we're cleaning around the catheter, we want to make sure to be careful and keep in mind that the catheter is there, not to tug on it. Okay, dip it in the warm water. Same technique, outer labia away from me, one swipe down. Outer labia closest to me, one swipe down. Inner labia away from me, one swipe down, working around the catheter. Inner labia closest to me, one swipe down, and then right down the middle, halfway, and then underneath the catheter. Okay, just put that in the laundry bag. Okay, now we're gonna pat dry. Outer labia, pat dry, away from me. Outer labia closest to me, pat dry. Outer labia, inner labia away from me, pat dry. Inner labia closest to me, pat dry. And then right, pat dry right down the middle. Okay. All right, Mary, we are done. Annie, we are done. Do you have any questions? I'm gonna put her legs back down, cover her back up. Do you have any questions for me before I go, Annie? Do you have any pain? No? Okay, I'm gonna lower the bed. Again, my name is Diana. I'm here till 2 this afternoon. Here's your call it. If you need anything at all, don't hesitate to call. Make sure the room is free of clutter. Okay, I'm gonna perform hand hygiene, open the privacy curtain, and then I'm going to go and I'm gonna document using my thing the time, the type of catheter, the amount of urine, the color of urine, any of the client's adverse responses, and the type or the size of the Foley, 16 French. All done.